What is refeeding syndrome and who needs to worry about it? Refeeding syndrome is a complex series of symptoms that occurs when someone reintroduces food after going a prolonged period of time fasting, or an individual is recovering from an eating disorder or extreme diet. In essence, when we're not eating or we're not eating enough of micronutrient-rich foods, the levels of electrolytes inside of our cells and inside of our bloodstream begin to be depleted, specifically things like phosphate, potassium, and magnesium. And when we consume food, specifically extremely high carbohydrate food, levels of insulin in our body will increase. This insulin helps shuttle whatever phosphate, potassium, magnesium, and other electrolytes that are in our bloodstream inside of the cells, which can help restore the amount of these electrolytes inside the cells, but deplete the amount of these electrolytes inside the bloodstream. And if the food that we are consuming isn't high enough in these key electrolytes, this can leave the blood levels of specific electrolytes low, causing many clinical manifestations. If you're not consuming enough potassium, you can get things like kidney issues, cramps, weakness, and paralysis. You can also get constipation, but the most major symptom is going to be heart arrhythmias and extremely dangerous complications with the heartbeat. Additionally, magnesium is extremely important for the relaxation of blood vessels, the heart, and the muscles. And if there is not enough magnesium inside of the bloodstream, the blood vessels, heart, and muscles will stay constricted, which predisposes us to excessively high blood pressure, a greater risk of muscle cramping, and more heart arrhythmias. Additionally, the source of magnesium for the brain comes from the bloodstream. And if we have low magnesium in the blood, the brain will be depleted in magnesium. And low magnesium in the brain leads to what's referred to as hyperexcitability, due to a complex series of mechanisms that I have described in a video before. But in essence, low magnesium in the brain can cause symptoms of anxiety and possibly exacerbate symptoms of ADHD. This is why I do think if you're trying to break a prolonged fast, or you're trying to help someone recover from an eating disorder, the advice to eat as much as possible and eat whatever you want may actually be slightly dangerous. And individuals trying to transition from an extremely restricted or no food diet to trying to increase caloric intake may be better off doing this with medical supervision, or at least under the guidance of a healthcare practitioner. But if you want an individualized approach to your health and nutrition, by truly understanding how your body works, send me a DM to sign up for coaching.